Hi class, welcome again to another session on biomaterials. So in the last video, we had a brief introduction about why we need to do testing of biomaterials even after they have been developed as a medical device. Now, let us move on to the safety testing of biomaterials. So you have a product. First of all, you have to test absence of toxicity in it. So once that test is passed, you have to run a series of tests such as biocompatibility tests, contamination tests, mechanical, electrical and radiation related tests, noise and thermal tests as well. And then finally you have to deal with the packaging and the transport. So our fifth unit is just about biocompatibility tests. So we shall discuss absence of toxicity and then go on to do biocompatibility tests. So we make sure during manufacture or during selection of biomaterial that we select material that do not induce toxins in the body and that do not trigger an inflammatory or immunological response once it comes in contact with the body, right? So even though you are very careful with selection of material, procedures such as coating the material or adding additives to improve the property of the material, or even the sterilization procedure that is used to sterilize the biomaterial, all result in toxin deposits on the surface of the material, right? So although medical devices or many medical devices do not come directly in contact with the individual, the national regulatory body is still very particular about making sure that there is no toxins available, because at some point someone would definitely touch the device and they do not want any human harm because of the deposits. So sterilization, often you use ethylene oxide to sterilize the surface of a material, and this results in deposition of ethylene oxide particle on the surface. So amount of ethylene oxide that is deposited on the surface needs to be tested, because if it is alarmingly high, then that can result in that can cause harm to the person handling the device. Right? The European Union is very strict about certain materials that have been used in electrical and electronic applications. These are called the restriction of use of certain hazardous material, and basically these are like guidelines or directives, right? The Directive 2011/65 EU has given you points to consider while you are using certain materials such as lead and then cadmium and mercury and bromine products and so on, right? So if you want to sell your device in the European Union, you have to make sure that you adhere to these points very strictly. Now even otherwise, say you say like, okay fine, European Union is very strict, so I wouldn't want to expand my market there, I'll just use it on Asians, right? If you decide to say that, I'm not being racist, but if you decide to do that, still it is a good practice to consider all these guidelines, because poison is poison, right? Whether it comes in an Asian's body or whether it comes in an European's body, poison is poison. So there's a definite reason why Europe has implemented these restrictions, and it is a good practice to keep in consideration all these after effects, and then it is good to adhere to these guidelines, because today you might start in a small scale business, say selling a device in Chennai, but then tomorrow you're probably doing very well and you want to broaden your horizons, then you would probably think about a larger consumer group. So at that point, modifying your designs and all would probably be very complicated. So initially, if you start off with a broad vision, whether you market it or not, definitely human race is not going to get affected, right? So that's the basic criteria. So you have materials such as lead, mercury, cadmium, hexavalent chromium. Then you have a polybrominated biphenyls and polybrominated diphenyl ethers. So maximum concentration by weight percentage is given in that directive, right? 2011/65, like direct European Union 2011/65 EU. right? That directive has given all these information. So if you're using lead in any other substance, you have to make sure, electrical or electronic appliance, you have to make sure that the molecular concentration of lead in your entire device is 0.1%. So this is about the material. So how do I test, right? Whether it is 0.1 weight percentage or 0.15 weight percentage. Even 0.15 would probably not be acceptable. 0.09 would be acceptable, but not 0.15, right? So how do I know? How do I test? Unfortunately, there are no international standard tests that are like, you do not have any gold standard tests saying that, okay, if my device passes this particular test, then I'm clear, I'm okay to sell my device in the European Union. That's not there. So popularly used device is X-ray fluorescence, because it is non-destructive. X-ray is ionization radiation, and X-ray fluorescence is non-destructive. So that can, if you expose it to X-ray fluorescence, the property of the material is not going to get changed, right? One of the main disadvantages of using XRF or X-ray fluorescence is that it cannot detect the actual element. It can only detect the compound, right? So it probably cannot detect the percentage of lead, weight percentage of lead. It would say, the weight percentage of lead oxide, right? However, oxide molecule can be more than 0.1%, but lead has to be less than 0.1%. So if you get the actual figure of lead oxide, you do not know exactly how much weight percentage of that lead oxide is actually lead. That detail is not available in X-ray fluorescence. Also, the resolution, if you have to have a really high-end device to get good resolution, and that would provide you the concentration limits that the directive is asking you to match, right? So investing that much is not it's not possible for everyone, right? Therefore, people have migrated towards more economical tests, which such as the liquid and gas chromatography. Now these are very, very effective in determining chromium and bromine components. If chromium and bromine is your problem, then you can use liquid or gas chromatography, and they're very, very efficient in detecting these compounds. Also, the detection of the limits, the equipment that you're using to detect the limits should be calibrated on a routine basis, and it should have the calibration and accuracy record along with the test results should be submitted to the notifying body. Because your uncalibrated device might say that your medical device is okay to be used in for medical purposes. However, if you calibrate the device, there are chances that the result might alter, right? Very good chances that the results might alter. Therefore, you have to make sure that you use calibrated and accurate device while you perform these tests. We shall discuss more on this in the next video. I hope you take care till then.